Hi guys, it's Beth with Aging Care Solutions, offering professional and personal experience and guidance for caregivers, seniors, and their families who are all navigating the care journey as we age. Welcome or welcome back. I appreciate you coming back and seeing and following my channel. If you like these videos, please subscribe and share. That way we'll be able to help more people. Today's topic, which the title indicates, is about fall prevention. This was definitely something that in my many years of being a care advisor, a senior care specialist, that I ran into all the time. In fact, it was one of the top reasons that we would place a care provider, a caregiver, in the home of many of our clients, was because people were having repeated falls. I mean, it is one of the top reasons. I think 65% of seniors that show up at the emergency room are there because they've had a fall. Now, many times, maybe nothing has happened, but many times there will be a lot of bruising. I mean, some people can't even put their arms out, and they will land smack on their face. And if you've seen anybody out and about when they're healing, they are completely bruised, and it can cover everywhere, their entire face. And it's, it is a long, very hard process for a lot of people. It's very painful, and you can damage your mouth, and just so many different things can happen. And there are some strategies, and I'm going to go over a lot of these today. And a lot of them are common sense, but then there's others that you may not have thought of that may be very helpful, especially if you're managing someone at a distance. It could even be a friend that you're worried about, or your husband, or your wife, or yourself. So some of these things are very simple, and then others you might, like I said, not have thought about. So let's dive into them. I'm going to look at my notes. Of course, lighting can be really important. A lot of times, especially if we get up in the middle of the night to use the restroom, you're going to want to have a night light in the bathroom where you can see. And if you have to have one on your side, inside the bedroom, that's going to light your way to around the corner into a bathroom, or if you're connected to your bathroom, have one in there and leave the door open so that, and of course clear anything that could be in the way. If you have a assisted device, so if you're using a walker or a cane or a rollator, keep that right by your bed so that when you do get up, if you're disoriented, if you just have to, kind of get yourself oxygenated first, just sit there for a minute until you sit up and you can kind of, really get your wits about you, and then proceed in the dark. But you'll want to have some lighting. Of course, removing clutter, any trip hazards like loose rugs, or especially on carpet. I can't tell you how many times I went into people's homes or their apartments or their condos, and I saw throw rugs everywhere. Everywhere. I was like, 3 in the kitchen, and in certain areas in the living room, over carpeting. All of it's a hazard. All of it is a hazard, even for other people, especially if they're wearing sneakers, because that gripping can, it's just a hazard. It really is. So you want to have and secure the flooring. So if there's anything that needs to be repaired, either fix it for them or hire someone to come in and do it. Call your landlord or whoever would manage that for you, and have them fix if there's any thresholds that are loose, or if your carpeting is coming up in certain areas. Sometimes you'll see that it starts to bunch and get rippled underneath. I think there's things that they can do that can take up one side of it and try to pull it a little bit more taut and straighten it out. I would also install grab bars. Some people have them all the way down their hallways. So if they're leaving their bedroom and there's a bathroom down the hall a bit, I've even seen railings installed on both sides of the walls. So you do what you have to do. Of course, using non-slip mats in the bathroom and the kitchen, and the lower that they are, the thinner that they are, the better. We did talk about grab bars. Of course, near the toilet is very helpful for some people, especially as we age. Our legs do not maintain their strength, but I suggest that you make that a daily requirement, is exercise so that your legs are strong. And you know what to do. All you have to do is do leg raises. Some people use their walker and do squats if they can. So there's different ways, and you can talk to your doctor and a physical therapist about it, or just do exercises so that you can keep your strength up and your balance. We did mention handrails, assisted device. I've seen families' homes where there's 3 levels. It's a split level home, which are not ideal for aging, I might add. The basement might be where they've got a living room and there's an extra bedroom or two, and maybe it leads out to the garage. There's a walker, and there's also laundry on that level. There's a walker on that level, and then you walk up the 6 stairs to the main living area where the kitchen is located, maybe a powder room. Sometimes there's a bedroom on that level, but not often. There'd be a walker on that level, and then you'd have to go up another 6 steps to where all the bedrooms are located in bathrooms, and there would sometimes be a walker at the top of the stairs. So there's different ways that you can kind of help and protect yourself and or your loved one, so that they do have what they need to, kind of navigate the home the best that they can. And there's also safety assessments. That's one of the things that we used to do. We would come into the home and we would walk through the entire house, make suggestions. We would check things off, and then we would add up what the fall risk percentage was. And sometimes we would make suggestions about how to improve the safety of this home as somebody was coming in. Many times we would tell them to go through the garage because there would be 1 or 2 steps, as opposed to a front entrance where there was 6 cement stairs. And a nurse would typically do that with us so that they could really make an informed and safety-driven assessment of that patient, their home, and their environment. You can consult with your primary care doctor. You can either do that through your computer at home, or you can go there in person and tell them, I've had a couple stumbles, I have had a couple falls, and if you're going with your parent or your parents on their own, they can write a list of questions and they could tell them, I think I'm a good candidate for either occupational therapy or physical therapy so that I can strengthen my legs and my balance, and my overall core and everything, so that I'm not as high of a fall risk, because I don't want to keep falling, because I'm going to go into the hospital and then rehab, and then the hospital and then rehab. So we really want to prevent that, and staying strong and healthy by doing regular exercise, and of course figuring out what time of day to best take your medications when you're trying to exercise, because a lot of times first thing in the morning, if your blood pressure is really high or if it's really low and you take your medication, it either might balance you out, or it might take your body a few minutes or an hour or so for it to stabilize. So you'll want to time that around how you feel. If you get up and you want to have a light breakfast and kind of get yourself hydrated, that might be an ideal time, is after you've had your medication and you are, you feel like you're awake and you're at your strongest. If the morning is the best for you, that's when you should do it. And there are things that you can do, like seated yoga, Pilates, Tai Chi. I see there's people at the gym. As soon as the class that I take, which is yoga, lets out, that class is packed. And they're mostly seniors that are in there. So they're, and some of them are, I see people that are in there that are in their 90s working out. There's a lot of people that are still doing weightlifting, because they're doing everything they can to keep up with their balance and their strength. Balance training is another thing. There's a couple of these programs that they have out there where we do a lot of functional, not only stretching, but also, one-legged balancing. And it's not easy, I'm telling you. And I'm strong, and I've been in fitness for a long time, but it is challenging for me because I've gotten older and heavier than I've been in a long time, and it does make a difference. But if I'm able to do it on one leg, I think I'm just going to continue doing this as I get older. I'm going to continue to have a fitness membership as long as I possibly can. And then if I move to a senior living community and I can't get to and from the gym for whatever reason, I'm probably going to be somebody who would institute like some sort of a fitness program with my neighbors and friends in the building. The other thing that I think is important is wearing firm shoes when you're doing your exercises and just navigating the house. I mean, I think wearing slippers, it just doesn't have, I'd rather tell you to be in your bare feet, honestly, than to be wearing slippers or socks, because I think that it could be a slip hazard, or it doesn't offer you the stability and strength and balance that you're going to need if you have a soled shoe under you. Some of the slippers that they make nowadays, I mean, I see the kids wearing these, my teenagers do. They go out the door and they're wearing these UGG slippers, but they have a firm bottom and they're sort of like a shoe, except it's just, it's like a lazy teenager most of them wear their pajamas with their slippers, so it's crazy. The other thing that I would suggest is making sure that your vision and your hearing are regularly checked, that you are getting those exams, because that can make a difference as far as depth perception. Especially if you're bending over. If you're bending over many times, people can fall that way. Especially if they're sitting up really high and they're bending over to tie their shoes or try to put their shoes on. A lot of it is the balance, and if you go too far over and your body isn't strong enough to pull yourself back up while you're putting them on, many times we have had people that are calling 911 because they have fallen forward while they're putting their shoes on. So, and I would also review my medications. I would and I would do this on the regular. If you go into the doctors a couple times a year, I would definitely find out what is the minimum that I really need, because they do make you dizzy. They can make you drowsy. I mean, I've seen people that are on dozens of medications, and a lot of times working with a good nurse practitioner that's going to be coming in, they can really look at your list and determine, does this patient really need these? Is this the same strength that they need? Maybe when they started this medication, they were heavier, now they're smaller. Is it potentially, are they over-medicated with some of the medications that are on this list? The other, of course, is staying hydrated. The very first thing in the morning that you should do is hydrate. So have your big glass of water and wait until you get a little something in your stomach if you have to take medications, and do that, and then get your day started with your stretching and your exercise. The other thing that they recommend is that you stand up slowly, and this has happened to me where I've stood up, and I'm telling you, it was after I had my kids, so I can see that my body was adjusting, my hormones were adjusting, but I know what it's like to be exhausted and or not feeling well, coming down with something and stand up and just have that very uneasy, unbalanced, and having to sit down. I do typically have very low blood pressure, so I do notice it at times. So standing up slowly, kind of getting your bearings, letting your heart pump the blood to other parts of your body, to oxygenate it, and then start moving. The other one is that we keep talking about and touching on is to stay active, encouraging all of us to stay active and avoid becoming sedentary. Because I don't know if you've ever noticed this, I have over the years, is that I could have when I was playing softball, when I was in my most active, if I ever had knee pain or an injury, the longer I sat and didn't move and tried to baby that, the worse my body felt. So I know, and I've had sort of an arthritic shoulder and elbow from injuries, softball injuries, that if I don't move that, if I don't stretch them, the pain gets worse and worse. So what I would consider doing is before you work out, take an anti-inflammatory, or you take whatever medication you're on, and then do your exercises, because it is going to help move any of the stuck energy that's in your body in various places. It's going to help start bringing good blood flow there, and it's just going to help your weakened muscles or worsening balance improve by continuing to move your body. I don't care if you do it seated. A lot of people are doing just simple exercises, arm raises, they're opening and closing their hands, they're lifting and lowering their legs, they're turning side to side. So the more you can keep moving, the more you can keep walking. If you're in an apartment, a senior apartment, using those hallways year-round is ideal because they are temperature controlled. It's a safe environment. If anything were to happen, you could just simply yell out, or if you've got your cell phone with you, you could make a simple phone call. And that's the other thing that I wanted to mention is that I wrote my list of things that right away I started thinking about. The devices like Philips Lifeline, there's a whole bunch of different ones that are on the manufacturing list out there, and they come in the form of a wristlet or a lanyard. And I've sat with clients and patients before, and we would make the phone call, and they would find out more about it. They make them now that are so sensitive that if you do have a fall, they can check on you as long as you're within a certain range of your telephone in your apartment. So you really have to consider, what options are there for me. Some people started using like an Apple iPhone or an iWatch that does where you can hit that wristlet and call and say, I've had a fall, I'm inside the building on the 3rd floor, or I'm inside my home. The other thing I would suggest, one of the things that we would request, is to have a lockbox on the outside of the home with a key to get into the house. So you could either ask a neighbor to hold an extra key for your parent or yourself. And if they're not home, then you could hide a lockbox or hang it over your railing or somewhere on your property so that EMS, your neighbor, food delivery, a caregiver can go in, unlock the door, put the key back, and lock it. Some people have even put in digital key entrance in their home so that a specific code is used that can be changed. Each person that's coming in, maybe you've got a primary care physician nurse coming in, and then maybe you've got a physical therapy team that's coming in to help you, and then your son drops stuff off during the week. Or you just have people coming to visit and you're in a different part of the home, or you can't get up quickly. You can simply have a code. They could each have their own code if somebody can program it for you. So yeah, these are just some of the the things that I think and that I have seen that have helped and worked. If you have concerns about falls, balance, I would talk to my doctor about it. I would even call their office and say, you know what? After I had the flu earlier this winter, I'm still not recovered to the degree that I need. Is there any way that you could write me an order for physical therapy to be covered under my health insurance? And sometimes they'll say, well, I have to see you, and just say, well, I have a computer. Can we just do a telehealth visit? If not, if you've got to go in and see them, it's certainly worth getting the physical therapy to come in to your home. There's typically not a deadline on this. If you were to go to an outside facility, there would be. It'd be limited to a certain number of visits. But because they'd be coming in your home, because you're deemed challenged and homebound at getting out and driving yourself, then you would qualify to have it brought right into the house. So I wish you all the best of luck on this. Maintaining and even improving your balance and strength is possible well into your 80s and early 90s. So don't give up on yourself. Don't think that, oh no, I can't really move around the way that I used to. No, none of us can. But with regular, determined, functional stretching and doing your exercises and maybe even doing light weights, you can maintain. You can even improve your health and your balance and your strength. So don't give up. I encourage you to find other ways. Find out if there's anybody in the building that's teaching any type of balance or fitness classes, or even search online, either on your computer or on your TV for regular exercises, and then just do it to the best of your ability. You don't have to, you can modify them to what you're able to do. And sometimes you don't even need weight. You just use the weight of your own arm to continue to stretch and move your body. So if you have any questions, please put them in the comments just so that I can answer them for you or suggest either articles or anything that I've run into while I've been working with families and or professionals in this industry. I'm truly grateful that you're here. I look forward to growing this channel for you. Please like and subscribe, and I'll see you at the next video. Take care.